the fact-finding part of the meeting for us. So we've already had the Ombudsman's report. So, Councillor Watkins, can I just ask you, are you content with that? And would you like a right to reply to the findings?
I would like a right to reply, Chair, because I believe this is a vexatious retaliatory complaint in light of the fact that there is a previous history between myself and the practice manager at the surgery.
Chair, just to be clear, at this stage, we're only looking at the factual evidence. So what the chair is inviting you to do, Councillor Watkins, is identify at this stage whether there are any facts in the Ombudsman's report that you dispute or that you challenge. If the facts are not in dispute, then we can proceed to the next stages of the process. So at this stage, it's purely a question of whether you accept all the facts as they're stated in the report.
I think I have no choice other than to accept them as they're stated in the report. Thank you.
Apologies.
I have accepted them, Chair.
Yes, thank you. Apologies for that. I just had a little bit of a technical issue. As it's going to be a public meeting, you will have noticed that our support officers have now started to record the meeting for us on our behalf. So just going down and just trying to follow through our fact finding, following on from that, the next part for us to consider is really, did the member fail to follow the code? Now, obviously for that, we've had the we've all had the investigation officer's report. We've had a chance to see that. Councillor Watkins has said that she's agreed at this moment in time the facts as are in the Ombudsman's report. So I think the committee now need to consider whether actually the councillor did or didn't follow the code of conduct. So what I think I'm going to, what I'm going to be doing now is I'm going to ask everyone part of the standards committee if they would retire, and what will happen then, the
Sorry, Chair. Just to be clear on that process, Councillor Watkins has now accepted the facts not in dispute. So what we're doing now is skipping stage 2 and proceeding directly to stage 3, which is for you to consider as a committee whether or not there's been any breach of the code of conduct based on those accepted facts. So I think before you retire, you need to hear from the Ombudsman's officers in terms of their findings in the report and why they consider there's been a breach of the code. And then Councillor Watkins will have the opportunity to respond.
Yeah, apologies. Thank you for that, Gareth. So in that case, as a monitoring officer quite rightly said, if I can pass over to the Ombudsman office to give us your report and the reasons why you believe there has been a breach of the conduct of the code.
Thank you for that. Thanks for the opportunity to provide our comments. So the undisputed and the disputed facts within the report have now been accepted as fact. The Ombudsman considered there to have been several occasions in which Councillor Watkins' conduct was suggestive of a breach of paragraph 7A of the code. Paragraph 7A of the code applies at all times, but in this case, Councillor Watkins held herself out as a member of the council and the health board of which she was appointed as a council representative when communicating with the practice and in a complaint to the health board. Whilst the Ombudsman accepted that Councillor Watkins was trying to be helpful to a patient, in the telephone call she was forceful in wanting to speak to the on-call doctor and initially refused to provide any details as to who she was acting on behalf of or what the purpose of her call was. She also said that she would approach the chief executive of the health board regarding the practice's refusal to put her through to the on-call doctor, despite being informed that the doctor was dealing with the patient's issues. It is difficult to see how Councillor Watkins' comments at that stage were helpful to either the practice or the patient at that time. The Ombudsman is of the view that Councillor Watkins attempted to use her position to seek an advantage for her constituent over and above other patients of the practice whose needs may have been more urgent, and that her actions were suggestive of a breach of paragraph 7A of the code. Councillor Watkins said that she had issues with the practice relating to her own healthcare prior to this incident, and she has referred to them today as well. She said the history with the practice was very negative, which in the Ombudsman's view may have influenced her behaviour towards the practice. Whilst that may have been the case, as Councillor Watkins claimed to be acting in her official position as a member of the Council and its representative on the Health Board during the exchanges, she should have been mindful of the need to act fairly and appropriately in her role. Councillor Watkins attempts to use her position as a council representative on the Health Board to encourage or pressure the practice staff to act outside of its data protection procedures in order for her to speak directly to the on-call doctor is suggestive of a breach of paragraph 7A of the code. Councillor Watkins accepted at interview that she should not have said she was acting in the capacity of sitting on the Health Board and that she was really doing it in the capacity of a friend to the patient. Councillor Watkins acknowledged that it was wrong of her to say this. Therefore, it appears that Councillor Watkins herself accepts that her conduct may amount to a breach of paragraph 7A of the code. Councillor Watkins' complaint to the Health Board, made 13 days after the telephone calls to the practice, contained information which was unfairly critical of the practice staff and did not accurately reflect the content of the telephone conversations. Councillor Watkins said at interview that she may have come on too strong in her complaint. The Ombudsman is of the view that the complaint was an attempt by Councillor Watkins to use her position in the Health Board to undermine the actions of the practice and create a disadvantage for it and its staff, and that her actions were suggestive of a breach of paragraph 7A of the code. Thank you.
Thank you, Lee, for that. Can I invite Councillor Watkins, please, to give us your side, please?
Thank you, Chair. I will repeat what I said at the onset of this meeting, that I really do feel this is a vexatious and retaliatory complaint, and I did not make contact with surgery initially as anything other than knowing this lady. I'm not actually even a friend of hers. I just know her as somebody who attends the befriending service meetings that I run, and I run those as a volunteer. She's a very vulnerable, very elderly lady with an eye condition that is incredibly painful and very distressing for her. And when she rang me on the date that she did, I was well aware of that condition, and I was very sorry to hear the terribly distressed state that she was in. I offered to try and help her. I said I would ring the surgery because she was telling me that the only help the surgery were giving her was an appointment to be seen in 9 days' time. She hadn't felt that she had received any possibility of any treatment. I would add here that I met this elderly lady some few weeks earlier in the village, where she was looking again very distressed. Her eyes appeared very painful, and I asked her if she was all right. She said she'd been to the surgery asking to see the doctor with the eye condition. She'd actually seen the practice nurse, who had said she should be referred to the optician, and that's where she'd gone, only to find the optician telling her she couldn't have an appointment for another week's time. So here was I with a very distressed old lady, very upset, and my only intention was to try and help her, in that it was 5 or 5:30 on Friday evening, and I wanted to ask the doctor if it were possible to provide a prescription which I would pick up and run to the chemist's for. I had no other intention other than to support this very distressed elderly lady who actually lives alone and whose condition I was aware of. Yes, I have accepted that I may have come on too strong, but I was so incredibly disappointed with the response that I received. And I did also, I should add, mention the fact that after 42 years in the health service, I am very aware of confidentiality. And I did say that if they contacted the lady in question, she would absolutely give her permission for me to speak on her behalf. I approached the conversation initially as knowing this lady. It was only ultimately in frustration, and bearing in mind that I did have all those years of working with GP practices in community and had always been able to pick up the phone and speak to a doctor. So I made a mistake here in that I shouldn't have expected that I could still do that in my current capacity, because I'm no longer a practicing nurse or midwife. However, I approached the conversation initially as someone who was concerned for this lady whom I knew well and who lived in my ward. Ultimately, as I said, I then took the decision to say that in terms of my being local elected member and councillor, I would be reporting the matter to the health board, because I felt, I do apologise.
That's fine.
Sorry. I felt that if I'd had the opportunity to speak with the doctor, a prescription may possibly have been provided and I could have been of help. That's exactly my recollection of the conversation. And I have said previously that if I did come on too forcefully, I would apologise for that. But I can't apologise.
So, sorry, Councillor Watkins, you seem to cut out there right at the end. I got you.
Sorry.
Can't apologise.
I can't apologise for trying.
Okay, just take your time. Just take your time.
Chair, is it okay for me to come in at this stage?
I don't think I can apologise for trying to help this lady who was in such terrible discomfort. I'm very concerned for her eyesight. Sorry.
No, that's fine, Councillor Watkins. Thank you very much indeed. As I mentioned earlier on, there's no cross-examination, but any questions through myself, and I believe Councillor Outley, you've just wanted to.
Thank you, Chair. I think it may be advantageous at this stage for me to come in and to give Councillor Watkins a chance to gather her thoughts.
Yeah, much appreciated.
It strikes me that under the code, if Councillor Watkins was trying to gain advantage for herself or a constituent of hers, yes, she would be guilty according to the code. However, what she was merely trying to do was to identify her role and her capacity in being able to speak on behalf of the constituent, not to gain advantage for the constituent, but to be able to speak. So she was identifying who she is. Councillor Watkins has spoken about the vexatious retaliation complaint. Let me just explain what that complaint was briefly. Councillor Watkins was hospitalised some time ago, and on her release from hospital, she had an appointment to go and see her local GP, who was going to administer her morphine tablets. Okay, that's what she needed. She turned up for the appointment, and the receptionist there said no, it's been commuted down to see the practice nurse. With the knowledge that Councillor Watkins has, a practice nurse cannot issue a prescription for morphine. It can only be done by the GP. She asked to see the manager who came down then to see her, and the manager said no, you have to see the practice nurse. Councillor Watkins got so upset because of the possibility of being left in pain because she can't see the practice nurse, that the doctor came out to see what the commotion was. And when he'd seen Councillor Watkins, he said, no, she must come to me, and sided with her rather than his front staff colleagues. And I believe at that time there was an accusation that she had been their words, not ours, bad mouthing the practice on social media. This is definitely not true. There's been nothing ever proven to that, and so there has been this dilemma between them. She made it clear that she was calling on behalf of a constituent who she met through her befriending service. This constituent is over 80 years of age. She has a balancing problem and very, very poor eyesight. So you could see that that she was desperate to seek help for this woman. She has had, as we said, over 40 years of state registered nurses experience. And as we know, other councillors on the panel, and indeed yourself, sir, you will know that when we speak when we actually go to speak, we make no apologies for trying sometimes to use our body of knowledge in circumstances such as this. So merely by saying, I'm Councillor Watkins, I'm a member of the Health Board, was demonstrating that she has a knowledge of expertise. One can look at it another way, but I would suggest we err on this side. And she was speaking with a body of expertise because she's had over 40 years experience with the NHS. She has apologised if things could have been handled better. And she has learned that maybe things were misinterpreted. Her enthusiasm was misinterpreted in a different way, that she was trying to gain advantage for herself and someone else. But that was not her intention. I've spoken to Councillor Watkins on this issue many a time. So thank you, Chair. And I hope members will take this into consideration as well. Thank you.
Thank you, Councillor Routley, for that. Lee, I see you've got your hand up. Over to yourself.
Yeah, at this stage we're at stage 3 to establish whether a breach of the code, and it seems we've returned a little bit to the events under stage 2 and mitigation at stage 4, whereas the focus at this stage should be whether or not a breach of the code has occurred.
Yes.
I should also underline the fact that we're also considering the subsequent complaint that was made to the Health Board under which the Ombudsman considers was a breach of paragraph 7A, considering it was made 13 days after the fact and contained incorrect and unfair criticism of practice staff.
Yeah, thank you for that, Lee, for the procedural error on that side of it. In relation to the fact finding, are we now content? Does anyone have any other questions based solely on that at this moment in time? From either Councillor Watkins, Councillor Routley, or any of the standards, my colleagues on the Standard Committee, or our colleagues from the Ombudsman Office? Okay, thank you for that. In that case then, Gareth, I think we are where I wanted to be earlier on, and going to ask those who are not on the Standards Committee to retire. We did have a little conversation about this earlier on, and what I'm going to ask you to do is to retire, and then either Pam or Sam will re-invite you back into the meeting once we've done our deliberation and considered what we need to consider. So if I could ask all those who are not standing members of the committee to retire. Obviously, the monitoring officer and the support will remain, and we will invite you back in as soon as we've deliberated. So thank you very much, everybody.
Sorry, could I just clarify, do we need to